Okay guys, so today we are going to learn in-depth CPT surgery coding pre-demo. So always my intention is to share knowledge, gain knowledge. So before starting our demo, I am going to tell about me. So basically my name is Harish Gupta. I have 10 years experience in medical coding and I am the creator of FastCoder 21 as well as SuperCoder 21 medical coding YouTube channels. So FastCoder 21 is for exclusively for English medical coding YouTube channel and SuperCoder 21 Telugu medical coding YouTube channel. Why do you want to learn surgery? So don't
Because
worry. Yeah,
more
go ahead. Yeah, excellent. Perfect.
opportunities.
Yeah, correct. So in surgery coding, you have more opportunities compared to other specialties. Okay. For example, if you know surgery coding, you can work as a general surgery coder. You can work as a IVR coder. You can work as a pain management coder. You can work as a GI coder. You can work as a urology coder. Okay, so as Umar told, we have more opportunities for surgery coders. For example, if you take IPDRG coder, so always they need to go only into IPDRG. They don't have any other option. For example, if you take ED coder, they need to go to only ED specialty. For example, denial coder, they know the CPT codes and they know everything, but they don't know how to code a chart. Okay, so like that, in surgery coding, we have more opportunities compared to all other specialties. Okay, so next, in surgery coding, most of the people are having one confusion. What is same day surgery coding? What is ambulatory coding? Okay, so before starting that, so we will learn about these definitions. Okay, so what is same day surgery coding? Usually in the live coding, we will call it as SDS coding or SDS coder. Okay, so what is the definition here? Procedure performed where the patient is admitted and discharged on the same calendar day without an overnight stay. Okay, so basically, if you code for same day surgery coding, you will code the charts where patient will join and discharged on the same day. So he will not stay in the hospital. So basically, it is less than 24 hours. Okay. So most of the time, the same day surgery coding is included with hospital outpatient billing or hospital outpatient department. Okay. So for example, we have facility. If you take facility, we have emergency department, radiology department, and pathology department, all those things, correct? So where this same day surgery coding resides. In the hospital outpatient facility, we have same day surgery coding. Okay. Next, we have ambulatory surgery coding. So most of the time, if you go to interview, they will ask you, what is the difference between same day surgery coding and ambulatory surgery coding? Okay. So what is ambulatory surgery coding? Surgical procedures performed exclusively in an ambulatory surgery center on an outpatient basis. Okay. Here, these defined by place of service. Most of the time, these procedure will be performed at the ambulatory surgery centers. So these people will perform only surgeries. Say they don't have any overnight stay. Okay. So here in ambulatory surgery coding, no inpatient admission is allowed. So why means these are the standalone ambulatory surgery centers. So they don't have the inpatient inpatient facility. Okay. So here also same day surgery. Here also patient will admit in the morning and leave in the evening. So mostly within 24 hours. Okay. So what is the difference between main difference same day surgery coding and ambulatory surgery coding is facility wise in same day surgery coding. So for example, patient is having the operation in the same day surgery. But due to that operation, patient is having the complications. So that time patient will admit to the hospital inpatient facility. Okay. So where if you code for same day surgery coding, sometimes you need to code PCS codes also. Okay. So whereas in Inpatient or ambulatory surgery coding, you will code exclusively for ambulatory surgery coding. So you will not possible to code any PCS procedures here. So in same day surgery coding, you can code PCS also, like CPT as well as PCS coding. Okay. In ambulatory surgery coding, you don't need to code PCS. Okay. So that is the difference between same day surgery coding and ambulatory surgery coding. So any doubt, guys? Same day surgery coding and ambulatory surgery coding. So this is very, very important for your interviews. So tell me, what is the difference between these two, guys? What is the difference? Anyone?
Same day surgery on same calendar day, the patient will be discharged in ambulatory also same thing, but it will be carried in ambulatory surgery centers.
Yeah, perfect. So basically, simple way, just remember like that. In same day surgery coding, if it is necessary, patient will be admitted to the inpatient facility. Okay. In ambulatory surgery, if it is necessary to admit to the inpatient, it is not possible. So that patient needs to go other facility. So that is the difference between same day surgery coding as well as ambulatory surgery coding. So this is very, very important for your interviews also. So in interview, they will ask you, what is the difference between these two? So that time you need to tell same day surgery coding most of the time related to hospital outpatient billing. So here after the surgery, patient may admitted to the inpatient facility based on the necessity. Okay. Whereas in ambulatory surgery coding, where patient will perform procedures on the ambulatory surgery centers. Okay. Where patient will not admitted to the hospital. Mostly it is not possible to admit patient into the hospital in ambulatory surgery center coding. Okay. Now we will see the differences between these two. Same day surgery, ambulatory surgery. So same day surgery, ambulatory surgery based on length of stay. So what is the minimum days, minimum hours for same day surgery, guys? What is the minimum hours? When do you consider same day surgery? So if it is less than 24 hours, it will be same day surgery. Okay. So ambulatory surgery based on the place of service. Okay. So place of service means here patient will be join in the ambulatory surgery center in the morning, and in the evening he will be discharged. Okay. In same day surgery, overnight stay is not allowed. Why means this is less than 24 hours. Even ambulatory surgery is also overnight stay is not allowed. Okay. So sometimes same day surgery converts into inpatient admission. So that time it is possible. But mostly same day surgery, as it is less than 24 hours, overnight stay is not allowed. Next, settings. So most of the time you will code same day surgery coding in hospital OPDs as well as ambulatory surgeries. Okay. For ambulatory surgery, you will code it only ambulatory surgery center. So here ASC means ambulatory surgery center. Here OPD means outpatient department. Okay. So same day surgery coder work in the hospital outpatient department. Ambulatory surgery coder work in the ambulatory surgery centers. Okay. So what is the payment system for these two? For same day surgery, we have OPPS. Okay. Outpatient prospective payment system. Okay. For ambulatory surgery, we have ambulatory surgery center fee schedule. So these two settings are having different types of payment system. That is the main thing you need to remember for interviews. Okay. So here if you see here APC, this is the ambulatory payment classification. Okay. Next, CPT limitations. So in same day surgery, we will code all procedures. Okay. Mostly related to the procedure which is not complicated. If it is complicated, patient will admit to the inpatient hospital. So in ambulatory surgery center, we will code ambulatory surgery center cover list only. So CMS will publish ambulatory surgery center cover list every year. So those procedure will be performed in the ambulatory surgery center. Observation allowed. In same day surgery, observation is allowed. Okay, ambulatory surgery, there is no observation. Okay. Why means in observation allowed in same day surgery, if it is necessary, for example, patient had the surgery in the same day surgery. So patient had the complications. So after physician will tell the patient to admit into observation first. Okay. In the observation, they will monitor the patient. If it is still complicated, so they will admit it to the inpatient department. Okay. If it is hospital, outpatient department. Whereas in ambulatory surgery, observation is not allowed. So same day surgery only observation is allowed. Okay. Next, inpatient admission. So as we discussed previously, after the same day surgery, inpatient admission is possible. Okay, as same day surgery is the part of outpatient department of the hospital. Okay, whereas the ambulatory surgery is not part of outpatient department. So here inpatient admit is not followed or not allowed. So that is the difference between same day surgery coding as well as the ambulatory surgery coding. So any doubt, guys? Any doubt here? Yeah, this is very important for your interviews. Okay. This is the basic definition you need to know the differences between same day surgery coding as well as ambulatory surgery coding. Okay. Next, so in our training, first we'll see the fundamentals. So introduction to CPT surgery section. So we'll see first guidelines as well as layout of the CPT book. Okay. Next, we will learn surgical package concept, which includes global periods, included versus separately reportable services. Okay. Next, we will learn modifiers. Like we will learn all the outpatient facility modifiers. Okay. So whatever is necessary, we will learn all those modifiers. Next, we will learn general surgery coding topics. Okay. After general surgery, we will learn plastic surgery coding topics. Okay. So after completion of this session, you can work as a general surgery coder or plastic surgery coder. Okay. So next, here you are going to learn general surgery, which includes hernia repairs, excisions, mastectomies. So these all comes under general surgery. Okay. So we will learn all these procedures: hernia repairs, excisions, mastectomy, live coding prospect as well as interview prospect also. So during our live coding, we will discuss what are the possible interview questions you will encounter in the same day surgery interviews, as well as how do you code in the live coding, all those hernia repairs, excisions as well as mastectomies. Next, we will learn orthopedic surgery. So where you will learn fracture care, arthroscopy and joint replacements. So for your interviews, fracture care as well as arthroscopy is very important. So we will learn all these step by step. Okay. Next, cardiovascular and thoracic surgery. Here in same day surgery coding, we will learn dialysis, IVR basics related to interviews like what is selective catheterization, what is non-selective catheterization, what is tunnel, what is non-tunnel. So all those things are important for your interviews. So that we will learn during the IVR basic section. Next, we will learn catheterization. So I will show you the, like anyone knows appendix L of CPT code book? Anyone knows appendix L?
No.
Yeah. So basically appendix L is the so what do you call appendix L is the chart for IVR coding. So if you master that one, you can code any type of IVR code. Okay. In our training, I will teach you how to read that chart or that table. Okay. And also you will learn neurosurgery concepts. Like you will learn spinal fusion as well as decompressions as well as eye and ear. Okay. Like laminectomies. Okay. Like foraminectomies. And mostly pain management. For example, if you learn neurosurgery, you can work as a pain management coder. Okay. So for example, you are trying for, so you are trying for job. So in one area you will see it as we need pain management coder. Okay. So that time after our training, you can work as a pain management coder also. Okay, so as I told you, we are having more opportunities for surgery coders nowadays. Okay, next in plastic and reconstructive surgery, I will teach you what is the difference between flap, graft, what is the cosmetic, what is the reconstructive. Okay, so these are very important for your interviews. So if you go to interview, they will ask you what is the difference between flap and graft. Okay, how do you identify flap and graft? So that I will teach you. So how do you identify flaps? How do you identify grafts? Okay, next we have, these are the advanced concepts. So endoscopic versus open procedures. So how do you identify endoscopic versus open procedures? Okay, so that thing we will learn during our live coding. Next we will learn bundling and unbundling. So usually we will call it as NCCI edits. So we will learn all NCCI edits. Okay, so we will learn few concepts related to inpatient versus outpatient surgery coding. Okay, and also along with that we will learn common denials in surgery coding, how to prevent those denials. Okay, so after completion of this training, you can work as a denial coder also. So why means denial coding people are coming into surgery coding. So why means in denial coding you will not learn much of the CPT codes. They know the CPT codes, but they don't know how to use the CPT codes. So in our training, you are going to learn each and every CPT code with their usage. Okay, so during our live coding, I will explain you CPT code, what is the diagnosis for that CPT code. So when do you need to use this CPT code with that diagnosis? For example, patient is having appendicitis. Okay, for example, for that appendicitis, you need to code appendectomy. So this is very simple. Why means appendicitis means inflammation of the appendix, and appendectomy means removal of the appendix. This is very simple. Since some situation you are unable to find the diagnosis for that CPT procedure. So in our training, I will teach you each code along with its ICD or diagnosis. For which diagnosis you need to use this CPT code. Otherwise, you may get the denial. So always you need to ensure the medical necessity between your diagnosis as well as the CPT procedure. So that concept I will teach you during our live coding. Okay. So next, in our live coding, you will learn all these concepts. Okay. First, we will learn modifiers. So modifiers are the very basic for same day surgery coders. We will learn modifiers. Next, we will learn NCCI edits. Okay. So how to use the NCCI edits. So I will teach NCCI edits. Next, we will see common surgical instruments. Okay. For example, you are coding one surgery chart. Okay. If you are familiar with the like instruments used in the surgery chart, you can understand the surgery chart very easily. Correct or not, guys? Correct or not?
Yes.
Yeah. So that thing we will learn first. Before starting our live coding, we will learn the common surgical instruments. So it will be make your life easy. Okay. Next, we will see types of incisions. Okay. So like what is the phanestoidal incision? What is the transverse incision? Okay. What is the vertical incision? So all those incision. Why means based on the incision, you need to understand location of the surgery. Okay, so that we will learn during our live coding. Next, I will teach you surgical positions. Okay, so remember, every surgery is having different positions. For example, if the patient is performing procedure on the back, okay, so mostly we will use prone position. So in the documentation or in the operative report, by seeing the prone position, you need to understand patient is going to perform procedure on the back of the patient. Okay. Next one, anterior. For example, if we see in the operative report, patient will tell that, so I have placed patient in the supine position. So as soon as you see the supine position, you need to understand that patient is going to place patient in the, or patient is going to perform procedure on the front side of the body. So those position we will learn during our training. And next we will see all operative report components. So here I will teach you how to what are the steps you need to take while coding the operative report. Okay, and also I will teach you how to choose keywords from the operative report. So you will have like training of every line discussion. So I will teach you each and every line, and I will teach you how to find the keywords. Okay. Next, I will teach you how to lead an index. So you know CPT index, correct? Like ICD-10 CM, we have CPT index also. So I will teach you how to lead an index. Next we have, so I will teach you 3M with Epic software. So if you go to any interview, if they ask you 3M software, so you can tell them that I know 3M software. So why means 3M software is the most expensive software in the medical coding world. So if you know 3M software, you can use any type of software. Okay. And I will teach you how to use Codify. So I think all of you know. So Codify is the product of AAPC. Okay. So I will teach you how to use Codify. Next, I will teach you 40 to 45 live chats with index leading. Okay. Next, during our training, I will teach you very important Q&A for interviews. Why means whenever my students goes to interview, they will send all questions to me. Okay. So if they don't know any answer, so those things I will accumulate and I will use for next batch. Okay. Next, I will teach you CPT updates for interviews. Why means, for example, if you want to go interviews in March or April, surely they will ask you updates related to CPT 2026. So that I will teach you. Okay. So I will provide job assistance in India, UAE and USA. Okay. And also you will get materials and recordings each and every day. So like every week. Okay. So if anyone wants to watch the video, so I have already created this video, CPT surgery arthroscopy coding. Okay. So you can watch this video. Okay guys, any questions here? So thanks for watching this video. If you like this session, please click on like button and also please subscribe to FastCoder 21 YouTube channel.